VA IBCT Backyard Lecture Series with Andrew Christensen, Ph.D. The seal of the Department of Veterans Affairs. VA Introduction to IBCT. Andrew Christensen, Ph.D., University of California, Los Angeles.
Integrative behavioral couple therapy. What are the key features of this approach? It's a behavioral couple therapy, as the name implies, but how is it different from other behavioral couple therapies? Also, according to the name, it's integrative, but what does it integrate? It's an evidence-based couple therapy, but what's the nature of that evidence? It's also a principle-driven couple therapy, but what exactly does that mean? And finally, it's a formulation-driven couple therapy, but what kind of formulation? Let me try to answer all of those questions. Integrated behavioral couple therapy, or IBCT, is a behavior therapy, but it's part of what some people have called the third wave of behavior therapy. The first wave was based on classical and operant conditioning, and people tried to use classical and operant conditioning to understand first how people learned emotions, such as fear, and how they might unlearn emotions, such as fear. And they used operant conditioning to alter the rewards, the contingencies, the reinforcers that followed behavior to try to shape new behavior. So that was the first wave. The second wave was cognitive behavior therapy. Rather than just looking at behavior, people realized human beings also think. They have interpretations, they have attributions, they have expectations, and all of those cognitive phenomena certainly have an impact on how they behave. So those were the first two waves of behavior therapy, but the third wave consists of several important features. It incorporates the first two waves, but it includes a greater emphasis upon emotion. Sure, there's behavior, sure, there's thinking, but there's also emotion. And when it comes to relationship, emotion is particularly important. People get into relationships because of the strong, positive emotions they feel. They often get out of relationships for the strong, negative emotions they feel. The third wave of behavior therapy emphasizes relationship. Human beings always act in a social context. And of course, when you talk about couples, we're always talking about relationship. Another feature of third wave approaches is an emphasis upon acceptance. In the individual therapies of the third wave approaches, it's often focused on self-acceptance or acceptance of negative feelings in self. In IBCT, the focus of acceptance is on partner acceptance, accepting of the partner, which also involves sometimes accepting negative feelings in yourself. Another feature is mindfulness, being aware of what's going on with you in the present moment. But in IBCT, we extend that to a kind of dyadic mindfulness, of joint awareness of what is going on in your interaction. A final feature of third wave approaches is that they are experiential rather than didactic. Rather than teaching people how to behave or how they could change their behavior, it relies on more experiential and evocative changes. So that's how IBCT is a behavior therapy, but more in line with third wave behavior therapy. IBCT is also an integrative behavioral couple therapy. But what does it integrate? Traditional therapies, particularly traditional behavioral couple therapies, focused on change. When a couple comes to therapy, they usually each want the other to change, and so traditional therapies try to facilitate that, teach the couple problem solving, communication, so they could change and thus be more lead to more positive reactions in the other. IBCT certainly includes a focus on change, but it includes an emphasis upon emotional acceptance. that partners aren't always able to change in the ways that the other would like, that some of the features of each partners are kind of baked in, and that in every relationship there must be some emotional acceptance as well as some adaptive behavior change. So IBCT tries to integrate strategies for promoting acceptance with strategies for promoting behavior change. This cartoon illustrates how just because you emphasize emotional acceptance, accepting the spots, doesn't mean you can't also require or ask for change. IBCT is an evidence-based couple therapy. And what that means is IBCT relies on 3 different kinds of evidence. First of all, there's the evidence from basic science. There's a lot of basic relationship science on the way couples interact and how couples influence each other in interaction. There's science on emotion regulation, how people emotions are triggered or escalate. And finally, science on behavior change. All of that feeds into IBCT. But more relevant for the evidence for IBCT is evidence on efficacy and effectiveness. By efficacy, we mean that there are multiple randomized clinical trials of IBCT showing that it is better than control conditions or other treatment. And finally, there's effectiveness data. And by effectiveness data, we mean how does IBCT work in the real world? Not as part of a clinical trial or a study, but how does it work with real people in the real world? And we have evidence for its effectiveness there. So those are the types of evidence on which IBCT is based. IBCT is a principle-driven therapy. And what do we mean by that? We mean it's not a step-by-step cookbook. You're not going to find in the protocol for IBCT what you should do in this session and what you should do in that session and what you should do in the first 20 minutes and what you should do in the last 20 minutes. IBCT does have a somewhat structured assessment and feedback phase. But the lengthy phase of treatment is the active intervention phase. And during that active intervention phase, the couple provides the material for discussion. The therapist facilitates that discussion using a series of intervention principles. Although there's a typical order to the intervention strategies, the specific therapist actions are contingent on the couple behavior. The therapist is applying principles as the couple presents various challenges to the therapist. So the impact of this is that it offers the clinician greater flexibility. It's sometimes more challenging to do because it's not a cookbook, but it offers greater clinical flexibility. And finally, IBCT is a formulation-driven therapy. Now, by formulation, we simply mean explanation or conceptualization. When couples come to therapy, they come to therapy with their own, usually competing explanations for their problems. And typically, those explanations tend to be blame-focused explanations. IBCT tries to develop an alternative formulation, an alternative conceptualization or explanation of the couple's problems. And that formulation, we're using that to replace the couple's explanation of their problem. And that formulation, we believe, will facilitate better coping by the couple with their problem. The IBCT formulation is developed during the assessment phase, but it's shared completely with the couple during the feedback phase, and it guides treatment during the active intervention phase. So that's why we call IBCT a formulation-driven therapy. Now let's consider the couple's usual formulation. It's a fault-based, typically blamed-focused explanation. As the cartoon implies, and let's imagine it's a couple. They're lost in the jungle, but they're trying to keep a focus on who's at fault for getting them lost. And that's the way couples often are. They're focused on who's at fault for the problems they're currently having. And they come up with, not surprisingly, different explanations. Usually they think the other is the major contributor to the problems in the relationship. Now, coming up with this explanation makes sense because couples often go through a process, or each individual goes through a process of, I loved my partner, I really tried to make this relationship work, now I'm unhappy, things aren't working. What happened? My partner must have done something. And I'm very aware of things my partner does that upset me, so my partner must be responsible for the problems that we're having. Now, the usual suspects when couples come up with fault-based explanations are what I call the three big faults. And the first big fault is that the partner is guilty of a kind of moral failing. So the partner is guilty of being selfish, or being inconsiderate, or being thoughtless, or being rude, or being too harsh. So the partner is guilty of one of those sort of interpersonal crimes, if you will. Another category is that the partner is not so much guilty as the partner is diagnosable. The partner has maybe not complete mental illness, although sometimes partners think the other is mentally ill, but the partner has an emotional problem. They're much too emotionally reactive, or they're depressed, or they're too anxious, or they're too obsessed with something. And so the problem is in the partner's mental or emotional stability. You have irritable spouse syndrome, as the cartoon explains. A final fault is what I call the performance evaluation, that the partner does not measure up. The partner didn't learn to communicate well, doesn't know how to love, doesn't know how to express love, doesn't know how to problem solve, doesn't know how to manage money, doesn't know how to be a good parent. An important life skill, the partner is not measuring up. Now, there's some truth in all of these explanations. Unless one or both are completely psychotic, there's some truth in these fault-finding explanations. For example, if Bill thinks that Sue is very selfish, it's probably the case that she's not next in line for sainthood. If Sue thinks that Bill is emotionally overreactive, it's probably the case that Bill hasn't achieved Buddha-like, Zen-like peace and tranquility. And finally, if one or the other thinks that the other one is not a good communicator, there must be some truth in that as well. So it's not that there's no truth in these explanations. It's that the explanations themselves don't facilitate the couple improving their relationship. Because with these competing explanations, now the couple has two problems. First of all, they have the original problem they had, whether it be about sex or money or children, or difficulty talking about strong emotions. But now they also have a second problem, which is about their explanation. They often get into arguments about not the problem, but about their explanation, whether it's because of his fault or because of her fault. Is it because you're bad, the verdict? Is it because you're mad, the diagnosis? Or is it because you're inadequate, the poor performance evaluation? Or is it me? And so now we have two problems rather than just the original problem about money or children or sex or whatever it is. So, in summary, I've gone over several key features of IBCT. How IBCT is an integrative treatment, it's a behavioral treatment, it's an evidence-based treatment, It's a principle-driven treatment and a formulation-driven treatment. And we've gone in detail about typical ways that couples formulate their problems, their explanations for their problems. And now in our next lecture, we're going to talk about how we identify a core issue in a couple and how we develop a different, more acceptable, and importantly, more clinically useful explanation that will guide us in helping the couple with their problem.
VA IBCT Q&A with Andrew Christensen, PhD, Dr. Barbara M. Dausch, Dr. Nate Tomczyk.
So what prompted you to develop IBCT, and what's important to know about the science behind IBCT?
There's a lot of evidence that existing treatments for couples are helpful for many couples, for most couples, but as many as a third are not helped, and even those who are helped are not helped as much as we might want. And importantly, even some of those who are helped initially relapse over the long term. So the late Neil Jacobson and I tried to develop a couple therapy that would be more helpful to couples initially and would have more enduring impact on their relationship. And we've gathered some evidence that supports this, although not dramatically so. In terms of the scientific support behind IBCT, there's both basic and applied science support. In terms of basic science, there's science on emotionality, on interactions between couples, and particularly on couple conflict that is consistent with the IBCT approach. More importantly, there's applied science, and there is efficacy research, which are randomized clinical trials comparing IBCT to a control condition. And then there's effectiveness research, which are studies of IBCT in natural settings, such as in the VA.
One of the things that I've really appreciated about IBCT is the focus on developing a shared understanding of the problem and empathic joining before you launch into direct change interventions. That felt to me different than previous models of couple therapy that I've been trained in. It's really common for couples to come in with different views of the problem, and if they can develop a sense of empathy for their partner's position and how what they do fits into a larger pattern, they're more likely to engage in change behaviors that are going to be sustained over time.
So absolutely, it feels important to cultivate a shared curiosity such that the couple takes action. I have a couple where one partner communicates directly and likes to think out loud, while the other is more comfortable managing things as they arise. Conflict comes when the former partner feels ignored and the other partner feels like he's constantly being treated like a child. IBCT treatment sessions help them to understand each other's actions as a function of who they are and who their partner is, and this helps them to navigate a new way to connect.
What if the couple's explanation of the problem is correct? What if, for example, the husband is selfish or the wife is neurotic?
Nate, there's some truth to each partner's explanations, unless they're completely psychotic, and they rarely are. So the issue is not that these explanations are completely false, but that they're not helpful in helping the couples with their problems. And there are really 4 reasons these explanations are not helpful. One is that they're one-sided explanations in that they imply the other person is entirely at fault. Another reason it's not helpful is that they're static explanations, implying that the husband is always a certain way or the wife is always a certain way. But in fact, there's a lot of variability in whether people are selfish or not selfish. There's a lot of variability in whether someone is quote-unquote neurotic or not neurotic, depending upon the circumstances that they're in. A third reason is that these explanations imply treatment that is very, very unlikely. It's unlikely that the husband in your example is going to come up with the conviction that he needs to be a less selfish person and go through some kind of character modification to improve his selfishness. And it's unlikely that the wife unless she's troubled by her emotionality herself, is going to go into treatment for her emotionality just because her husband tries to convince her that she's neurotic. And finally, these explanations lead to what we call a battle of explanations. And so in addition to the conflict that the couple has, now they're in a battle about the reason that they have these conflicts, and that makes their struggle even more intense.
So what if one partner acknowledges and is willing to address a characteristic of their own, such as selfishness or neuroticism?
That's great if couples are willing to acknowledge a characteristic in themselves that may be problematic for the relationship. And if they want to work on that in a professional setting, we can facilitate that with a referral. And we certainly want to help them work together so that characteristic doesn't keep pushing them apart. A positive outcome of couple therapy is that partners often feel less defensive and more willing to acknowledge a characteristic in themselves that may be problematic for the relationship. And that acknowledgement in and of itself often helps the relationship. And then if they're willing to do some work on it, that can be even more helpful.
I'd add that oftentimes the partner trait that's being blamed for the problem was there long before the problem took root and during a time when the relationship was actually going really well. One of the things that we can do in IBCT is hopefully help build some acceptance around that difference, as long as it's not abusive behavior, of course, and help the partner see that the behavior has been polarized over time as a result of the context and the interaction that they've had. Ideally, if they can't build acceptance around it, at least they can see what can be changed and what's likely not to be changed with couple therapy.
Yes, as a couples therapist, we're treating the relationship, not any individual mental health issue, even if there's truth to a trait or a diagnosis. I try to think beyond these initial explanations to understand why might the husband appear particularly selfish to the wife, and why might the wife appear particularly neurotic to the husband. The richness of IBCT treatment is unpacking these truths, which can generate intimate conversations about who they are as individuals and as a couple. It can also lead them back to why they were attracted to one another. Maybe he saw her neuroticism as caring, which he never had in his past. And maybe she saw his selfishness as having strong boundaries, which she never had in her past. So Andy, because it's principle driven, won't it be harder to learn IBCT than to learn a more structured approach?
Yes, certainly IBCT is more difficult than a treatment that would have detailed outlines of what to do in each session. But I believe that IBCT shows greater respect for the uniqueness and diversity of clients who respond very differently to different interventions based on their unique genetic makeup, their social learning history, their cultural background. And so it's not a one-size-fits-all treatment. I believe IBCT is also more respectful for the skills of the clinician who we trust will apply the principles in a helpful way for the couple and respond if the couple is not being responsive to a particular intervention.
Well, I agree. It's a little bit more difficult to learn a principle-based EBP. I think what we've seen over the last 10 years that we can train clinicians who have never even seen a couple before in IBCT and train them really well in a relatively short period of time.